Hi, it's Dr. Zomerlei at the Center for Plastic Surgery. Today we're going to be talking all about drains. This is going to be 3 parts of our video. We're going to have drain care, problem solving with our drains, and drain removal. So let's first talk about drain care. This is what the drain looks like that we often use in our surgeries. It's called a JP or a Jackson-Pratt drain. This white portion is the portion that will be inside your body. It'll be sutured to the outside of your body about here, and then this length of tubing will go to the reservoir here that looks a little bit like a grenade. It works via suction, so the drain will be compressed like this, and you'll have either a plug or a screw top that goes over that, and that will hold suction in that manner, and that will draw the fluid out of your body and into the reservoir. Your homework with your drain is twice a day to unscrew or unplug the top, to note how much drainage, and there's numbers on the side, how much drainage is in your reservoir, and to empty it into the toilet and flush it. Then you compress the drain again and put the plug or the screw top back in, and it should hold suction again, and all the fluid can go into there. Problem solving your drain. It's not uncommon for the drain to become a little clogged, sometimes with a clot. It's important every few hours when you're awake to strip or milk the tubing of your drain to keep it clear from debris and to keep the fluid flowing. You do that by compressing or holding really firmly one end of the tubing that's coming out of the body, and then using the other hand to milk the tubing, and then you advance the holding hand and you milk again with the other hand, and you march along your tubing. Usually it takes 3 or 4 tries like this until you work any clots into the reservoir here. That'll help keep your drain working and the fluid flowing into the reservoir. Another thing that can happen is if there's a little clot in the tube, sometimes fluid can come out around the opening in your body. If that happens, it's not dangerous, but it just means you may have a clot again in the tubing, and so the fluid's coming around the drain instead of through the drain. Milking the tubing, as we demonstrated before, will often alleviate that problem. So drain removal. Your drain will be ready to come out when there's less than 30 milliliters or 30 cc's of fluid coming out every 24 hours for 2 consecutive days. The drain, again, has little marks on the side, so when you're performing your homework sheet and you unplug the drain and empty it twice a day, you're going to write down on that homework sheet of paper how much is coming out, and that's important for you to bring with you on the day of your appointment. Your drain is going to be secured to your body by a black stitch that's attached to your skin. So when the drain is ready to be removed, we're going to snip that little stitch and we apply a little pressure to the drain and it slips right out. It feels a little weird, definitely does not hurt, so don't be intimidated or scared about having the drain removed. We put a little ointment on your skin and a little dressing, and that stays in place for about 24 hours. At that time, you can remove it and take your shower as you normally would. I hope this video has been helpful for you to understand your drain and how to take care of it.